Indonesia is one of the 27 countries with high burden of multi-drug resistant tuberculosis, with an estimated 2.8% between new cases of tuberculosis and 16% in previously treated tuberculosis. Therefore, ladies and gentlemen, if we don't do something real towards these problems, by 10 years from now, we will suffer from loss of quality human resources in Indonesia. Therefore, here I am, Zulfina Ramadhani Fauzanuddin, as the representative from Universitas Jenderal Sudirman for Pemilihan Mahasiswa Berprestasi Nasional 2017, propose you my idea to answer the multi-drug resistant tuberculosis in order to create a better community. There are two main causes of why this kind of multi-drug resistant tuberculosis can happen in patients. First is due to the medication's error, and the second is due to the patient's non-compliance. In medication error, for example, in inadequate treatment, the bacteria will undergo such mutations. This kind of mutations will happen and transfer to another bacteria by doing a reproduction and conjugated method. Another factor that can contribute to the development of tuberculosis resistance is patient's non-compliance. Moreover, the treatment for multi-drug resistant tuberculosis has a bigger obstacle. For example, the patient should take at least 5 medications per day plus 1 injections. This kind of treatment are often associated with high cost, adverse effect, and also the unpleasant experience for the patients. There are two ways that we can do to solve the medication error. The first is to increase the doses, and the second is to find a new regimens. The first option is not so favorable in these conditions because higher doses means higher adverse effect. Thus, I propose you the second option, which is to find a new regimens to combat the bacteria. Garlic and allium sativa. Garlic has been proven by some researchers to have various biological compounds such as allicins, adjoins, glycolic acid, myristic acids, and also polysulfides. Allicins and adjoins have the ability to inhibit the enzyme that catalyzes the biosynthesis of glycolic acid, which is the protective factors for the bacteria. While we know that glycolic acid and myristic acid have the ability to localize the enzyme inside the mitochondria and reticulum endoplasma. Thus, it will affect the survival and the growth of the bacteria. In addition, the advantage of the garlic is also not directly working on the bacteria, but also adverse the environment and deter the development of resistant strains bacteria. To make sure that the garlic is working in the body, we use an implant method in subdermal. It's really easy and is similar to the contraceptive procedure. Firstly, we just need to make a patient under an anesthesia to make sure that they are not feel painful. Secondly, we just need to make a cut through the skin around 2 centimeters, and we use a trocar to make a way for the device to go through to the subdermal layer. And the procedure is done. The implant that we use is different from the contraceptive has. We use a polylactic glycolic acid which can gradually unravel so that we do not need to take it out after the treatment is finished. The antibiotic therapy is best given in steady and continuous manner so that the bacteria wouldn't have a chance to thrive. The drug administration through the implant method can increase the bioavailability, duration of actions, and also stabilize the concentration in plasma. Also, before we extrude the garlic to the implant, we also form a nano-emulsion to increase the stability and also the penetrability throughout the body. Well, ladies and gentlemen, this kind of idea still needs more studies and further research in preclinical and clinical studies. But now at least you know that tuberculosis is curable.